Hey guys, come along with me today to do some talks. We are doing frontalis talks on this patient. So as you can see, I'm marking that lateral border of the frontalis. I'm marking across her frontalis where she has movement. On the other side, marking that lateral border of that frontalis. And then I am putting an injection right directly on that lateral border just so we don't spock her brow. And then once again, I'm doing a second row here, kind of making sure that I'm not overlapping my dots so we get good diffusion throughout the whole frontalis when we get that diffusion of a nickel to dime size. Here we are moving on to the glabella complex. It's a 5-point injection with the procerus and the 2 medial and lateral corrugators. I had the patient make an angry face in order to animate the anatomy for that injection. Next, I'm marking the masseters. I draw a line from the corner of the mouth to the tragus, and then I have the patient clench just so I can kind of feel where that anatomy is and see where I'd like to inject. That deep masseter runs right above that superficial masseter, so right where that line that I drew for that superficial masseter, it's going to be right on that line for that deep masseter. So here again, having the patient clench for those superficial masseters and then clench here. And when you inject the deep masseters, it's going to be a 45-degree angle, full needle depth up towards the ear. Once again, I'm moving on to the lower face, so we're looking at the DAOs. I tell my patient to show me their bottom teeth, making sure that I am not close to that DLI because I do not want to hit that person's DLI and drop their smile. So making sure that you really can see anatomy on that injection is super important. We're also doing a lip flip, the mentalis, and a brow lift on this patient. So that's what I marked up to. For a lip flip, I just kind of have them smile really big to see if their lip curls under when they smile. For their mentalis, I have them make a pouty face to see that dimpling effect in their chin. Here we are now injecting that frontalis. So as you can see, I'm injecting half needle depth, 45-degree angle, and I'm just working across that frontalis in a way that works best for me. So I just like to go left to right. And then I eventually switch the sides of the patient and inject at an angle that's better for me on the other side. So once again, half needle depth, up away towards those brows, and making sure I'm covering that whole lateral border of the frontalis. Now I'm moving on to that glabella. Here I am injecting the procerus, 3/4 to full needle depth, 90-degree angle, and then these medial corrugators, which is going to be a true 3/4 needle depth, and then the lateral corrugators, which is going to be a half needle depth. It's very important that you are at the right depth for your medial and lateral corrugators, just because if you're too deep, you can hit that frontalis underneath those brows and drop the patient's brows. So we want to avoid that at all costs. Here I am marking up for that brow. I already marked up, I had them close their eyes as tight as possible to kind of identify where we are treating that depressor muscle. So I usually do an injection at the arch of the brow and then the tail of the brow just to kind of lift that brow more laterally. Here I am injecting those masseters, making sure that I like where I'm injecting. That line from the corner of the mouth to the tragus is very high. Usually I just do that and I'm very mindful to stay below that line. That line though is a great indicator for your deep masseters. So again, you're falling off of that zygomatic arch and you're feeling that little pocket there and having your patient clench. And when you feel that deep masseter contract, you will know, but you're going to inject up towards the tragus at a 45-degree angle for that deep masseter. So superficial masseters clench. I always do a 3-point injection here just to prevent a fish gill. And then here we are with that deep masseter. So 45-degree angle up towards that tragus, utilizing that full needle depth because that is a deep muscle there. Now I'm injecting that DAO. Like I said, you don't want to ever hit the DLI. So make sure that you can identify that anatomy and then mark it. I always confirm beforehand, and I am always standing on the opposite side of my patient and injecting up and away from their DLI. Next is the mentalis. It's a 3/4 to full needle depth injection on the chin. I like to do a 2 to 3-point injection just to make sure that I'm getting a nice even diffusion throughout that chin to target all of that dimpling. And then lastly, we have a lip flip here. So we are focusing on that top lip, 4 injections on that top lip, very superficial. This should bleb. It should just be the tip of that needle.